Hello and welcome to Newsclick. Today we are in conversation with Professor David Sanders, Professor Emeritus at the University of Western Cape in the School of Public Health. Thank you, David, for being with us. Now, we would like, given your vast experience in this area, to tell us a bit first about what in many quarters is being talked about as the global health crisis. Now, why do we say it's a crisis, and what are its dimensions?
Thanks for having me. Well, many people do not talk about a global health crisis. I mean, many of the UN agencies point out with some truth that in fact health globally is better than it's ever been, that mortality rates have dropped faster than ever before.
And all true?
That is true, except for some regions. So in some regions of the world, notably sub-Saharan Africa and the former Soviet Union, there has been a slight increase in mortality in the former Soviet Union, especially amongst men. And in Africa, there's been virtual stagnation, no improvement in life expectancy. However,
so Soviet Union is post the demise of socialism?
Yes, post-Soviet Union. So what they don't talk sufficiently about is the fact that there are also unprecedented inequalities in health. And that's really what the crisis is. Because it's very clear that some segments of society in many countries, most countries actually, are achieving very good health outcomes. So high life expectancy, living longer than ever before, lowering extremely low, for example, young child mortality rates in some of the richer countries and some of the middle income countries, but huge inequalities between North and South, which have increased dramatically. For example, young child deaths, under 5 mortality. There was a ratio about 30 years ago of 9-1 between global South and North in terms of rates. So we're 9 times as high in the global South. 30 years on, 27-fold difference. So there's been an extreme widening of the gap between North and South, and within countries, a widening of the gap. So, for example, in a country like India, under 5 mortality in the richest quintile of the population is about a quarter of that in the poorest quintile. And similarly with other health outcomes.
So we are saying that the gap is increasing, but overall there is an improvement in health. So if someone were to argue that in the long term, this would mean that finally everybody would be healthy, what would be your response to that?
That's highly unlikely, because what we are seeing is, especially in the global South, but to some extent in the global North as well, we are seeing the emergence of diseases of development, in inverted commas, so by which I mean heart disease, cancers, metabolic disorders such as diabetes, alongside the old diseases of poverty. I put these in inverted commas because actually the poor are now also experiencing early onset diabetes, heart disease and so on, while at the same time their children suffer from infectious disease morbidity, the old infectious diseases. So we are seeing, in a sense, we are seeing a dual pattern on many levels. We're seeing a dual pattern between countries, where in the advanced countries there's been transition to these non-communicable diseases, albeit with huge disparities between rich and poor and growing ones. But in southern countries, many countries are not making that transition. Or to be more precise, many sectors of those populations are not making that transition. They exhibit a dual pattern.
Now, if you said earlier that this is a global phenomenon, more or less, in which case, are there any structural factors at the global level which can explain, one, this growing disparity, and the other, that what you are pointing out too, that communities, especially vulnerable communities, seem now to be trapped in a cycle, and they are finding it very difficult to escape out of it?
Yes, of course there are structural factors. I mean, one can conceive of the factors that result in these disease patterns to use a metaphor, as almost like a stream. So we can think of the downstream causes, which are the immediate biological causes, all the way up to the most distal or upstream causes, such as global economic structures. So, to give an example, we find that with the old type of infectious diseases, many of them are underpinned by undernutrition. So undernutrition remains rife. In fact, 1 in 4 children globally is stunted, chronically undernourished. Yet, world food production is at unprecedented levels. So it's clear, and even in some countries, I believe even in India, there is a surplus of food, and yet there continue to be a very high percentage of children who are extremely undernourished. So then we have to ask, okay, why is it that amidst plenty, we find this persisting problem of chronic food insecurity and infection? Well, it's because the living conditions and the purchasing power of poor people has not really improved, and that there are factors which control the global food supply, which are making it more and more difficult for poor people to get adequate diets. And on the other side, to use the nutrition analogy, we are seeing more and more chronic diseases related to modern diets. So diets which consist increasingly of processed foods, fast foods, foods which are high in calories, with refined carbohydrate and fat, very salty, and these tend to produce problems like diabetes, high blood pressure, heart disease, and so on. And we find that the poor are now also increasingly purchasing such diets, because often they are cheaper, they require less cooking, less time, and they're convenient and tasty. So using nutrition, we can see that there are downstream factors, diet, what people eat, and the upstream factors, the structural dimensions, which determine these. And these are increasingly, as far as food's concerned, driven by liberalized agricultural and food trade, and a sector increasingly dominated by fewer and fewer very large transnational food corporations.
Are you saying that this is somehow related to the structure of capitalism today?
Yeah, absolutely. There's no question about it.
And how do you actually counter these trends? Now, if these are structural factors, one response I understand would be that you need to reverse the neoliberal ideological penetration into policy making across the world. But concretely in the health sector, are there other methods that one can use to at least mitigate the impact of these policies?
It would be possible for governments to intervene in the food chain to promote better diets. So, for example, governments could, although it wouldn't be without resistance, as we have seen in many countries, impose taxes on unhealthy foods. For example, sugary beverages, Coca-Cola, for example. and at the same time subsidize healthy foods. Of course, it's extremely complicated, as we saw recently. I think you possibly know that recently in New York there was an attempt to limit the volumes of sugary beverages sold, so to try and reduce the size of what people could purchase. This went through as legislation, but the soft drink companies took the mayor of New York, in this case, to court, and they reversed that. So this is in the most powerful country in the world, in a way. So it's extremely difficult for countries to do this, but they can do this. So in Brazil, for example, there is a big policy intervention called Bolsa Familia, which is a conditional cash transfer. So that conditional cash transfer is given to poor people, and much of it goes into purchasing food. So there are other interventions which try to ensure a better food environment. For example, the school feeding program in Brazil. There's recently legislation passed in Brazil whereby all school food needs to be sourced, 30% of school food at this stage, I think they will increase it, needs to be sourced from local small producers and needs to be fresh food. So there are ways that governments can intervene, although governments, of course, are extremely restricted by WTO undertakings.
And in the health system, are there any interventions that are possible, even within the constraints that we have? I'm also asking you in the context of, on the other hand, what we are seeing, the range of public services which are today being dismantled, and this is happening not just in the global south, but also in the global north, where earlier it was entirely taken for granted. So we have a trend of public services being dismantled and health services being one of the key ones which are under attack. Is there a response possible to turn back this tide?
Well, I think that the first battle that needs to be won is to confront the assertion, it's mostly an ideological position, that the private sector is more efficient and effective. So for that we need evidence. So there is some evidence showing that in countries where public sector health dominates, health outcomes are better. And that in countries where private insurance...
Like countries where...
Well, for example, Costa Rica, one country. Of course, Cuba. Cuba is unusual, as you know, because of its political system, but there are also countries whose economies remain capitalist, but where the state intervenes in the social sectors. So Costa Rica is one, Thailand is another, and then there are some smaller African countries. Brazil is an example, although in Brazil there are still huge disparities because of a very big private sector, but where the state controls the sector, they have some very thoughtful policies, such as some that I've mentioned, where they intervene to ensure better, more accessible, better quality health services. So in relation to nutritional problems, Brazil has managed to reduce childhood undernutrition very significantly.
But international agencies today, many of them, are arguing that it doesn't matter which cat catches the mouse as long as you catch the mouse. In other words, that it doesn't matter whether provision of services is by the private sector or the public sector, and all that governments need to do is to regulate the health sector and see that everybody behaves properly. Is that something that you would agree with?
Well, there's a lot of evidence that privately funded, or worse, private services funded from the public purse are a great deal more expensive and less cost efficient than well-functioning public services. Mind you, the public services need to be well-functioning. So of course, one of the problems, including in India, is that public services don't function very well by and large. So in the countries where public services have been invested in, and especially the human resource component in public services at all levels, from the policy level to the service delivery level, have been invested in, and by which I mean enough people in the right places with the right skills, then we see very good health outcomes, especially in countries where the public sector dominates.
Okay, so we've talked about structural issues that need to be actually addressed, including the structure of capitalism itself. We've talked about the need for reform in the health sector of a different kind, where bringing back the public. Now, is there a role for movements, especially as you're one of the founders of the People's Health Movement, of being also part of making a difference? And if so, what kind of role do you see for movements?
Yes, there's an absolutely fundamental role. If one looks at the history of health improvement, going back even to the 19th and early 20th century, where the UK is the best known case because statistics were kept there almost earlier than anywhere else. Actually, they're kept earlier in Sweden, but in the UK, statistics were kept from about 1840. And if you look at the improvement in health in the UK, it really preceded any effective medical measures like antibiotics. So why did it improve? Well, it improved because living environments improved and working environments. So a better, more reliable, more equitable food supply, eventually better water sanitation, better working conditions. But these did not happen simply because legislation came into being. Preceding and accompanying that legislation were huge struggles by people. There were struggles in the UK, in London, during cholera outbreaks in the 1830s. There were struggles against exploitative and dangerous working conditions, the formation of the trade union movement, and later the Labour Party. And all of these struggles led to reformers being thrown up and reforms being enacted to essentially introduce public health legislation, as we call it. Of course, the UK's path can't so easily be followed because the UK at that time was a major imperial power, was deriving a lot of wealth through colonial exploitation. It was the factory of the world, and great wealth was being generated and redistributed to some extent by popular struggles. But there have been later examples, much later examples. For example, Brazil, which I've talked about. Brazil, after the end of the dictatorship, actually slightly before the end of the dictatorship, enacted on the basis of huge popular mobilizations, a whole number of new social policies. So the people who are the architects of Brazil's health policies were people who were involved in the struggle against the dictatorship. And there are many other examples. You know, we can look, for example, even at examples which didn't last long, like in Zimbabwe, for example, where in the wake of the national liberation struggle and great pressure from the population, there were many social reforms enacted. The economy remained capitalist, but government invested heavily in health, education, and other social areas, and there were rapid improvements in health. Sadly, because history doesn't move in a straight line, much of that has been turned back.
So last thoughts. Do you see something positive today in the fact that there are now a number of global movements? They're probably still more fragmented than they should be, But you see global movements again emerging. So these are not just country level or regional movements, but coming together globally. And do you see that as a positive outcome of globalization that can actually be the something that's in the belly of the beast and actually change the situation?
I think I see it. You know, I've been teaching in universities for over 30 years, and I encounter a lot of young people who are coming into public health. Of course, that's a biased sample, because those who go into public health are almost self-selected. But I do see over the last decade or so, and probably accelerating, more and more interest in some of the ideas we've been talking about. There's much more interest in...
Why is that so? Why are young people more interested?
I think it's because young people see for themselves extremely bleak futures if the current status quo persists. I mean, they see their peers emerging even with tertiary education, unable to get jobs. They see misery around them, even if they're in so-called advanced countries. They see conflict around the world, which is now even impacting on them. And some of them are starting to ask questions. They're asking questions about whether what is proposed really offers a way forward. So in that sense, I think there's a big opportunity for progressive movements to grow. I don't think that progressive movements have yet found exactly the correct formula, because the objective situation is really critical. And yet we see, with some exceptions, not very much movement on the ground. Or we see movements, such as, for example, the Occupy Wall Street movement, which peaked and seems now to have defavessed. We see some mobilizations on the streets by Spanish youth, more than 50% of whom are now unemployed. But we don't see a sustained movement building.
But you do see that we are starting to get there.
I think I see much bigger opportunities. I see in the health area a lot more interest in people's health movement and associated movements, and I see similar developments in other areas, like the environmental movement. I think the big challenge is for these movements to be more attractive than they are presently, especially for youth, and for the movements to start to connect with each other. Because ultimately, the root of all of the problems is the same: unequal, unsustainable economic and political system.
Thank you, David. It's been marvelous talking to you.
Pleasure.